All right, you're still here on the AM show, and it is said that health is wealth, which will then also mean that if you're not healthy, you could drain your wealth. So what are the main health issues we're having to deal with in Ghana? Of course, we have malaria, and we found a vaccine for malaria, which is great. But there's also cancer in its various forms. Breast cancer gets a lot of attention, but then liver cancer, which is also an issue and accounts for 14.4% of all the cancers recorded in the country, receives very little attention. So alcoholism can destroy your liver and drain your finances too as you consume more of the alcohol. We've been joined by Theobald Owusu-Ansah, the president of the Hepatitis Foundation. He lost some relatives to liver cancer and vowed to be part of the solution. He's joined us in the studio. Good morning to you, and thank you for making time to speak with us.
Yeah, good morning.
All right, so we also have Dr. Amaku Dua, a gastrologist from the UGMC, and he's joining us via Zoom. Good morning to you, Dr. Dua.
Hello, good morning, Israel.
All right.
And thank you for the opportunity to join in this discussion.
Yeah. So why do you think that liver cancer gets that little attention?
I think for me, it's about education and then the publicity, okay? Because we hear a lot about breast cancer because more people are involved in making sure that people get to know about breast cancer. The same thing applies to prostate and then the cervical cancer. But I think when it comes to liver cancer, we don't hear much because probably people are not really supporting us to ensure that people get education concerning liver cancer. That's why probably we don't hear a lot about liver cancer in this country.
What should we know about liver cancer, Dr. Dua?
What we should know is that, you see, when it comes to cancers in this country, putting all cancers together, liver cancer is the second commonest cause of cancer diagnosed in this country. The first one is breast cancer, followed by liver cancer. If you take men alone, liver cancer is the first commonest cause of cancer in men. And when it comes to women, it's the third commonest cause of cancer in women. But when it comes to cancer death, liver cancer kills more than any cancer in this country. So the number one cause of cancer death in this country is liver cancer. And the worst about it is that it's killing the productive age group. I mean, the youth and then the middle age in this country that are taking care of their family. So looking at the median age at which people are affected with liver cancer in this country is 44 years. And most of the time when it is diagnosed, by the time it get diagnosed, it's at advanced stage. So the median survivor is 2.5 months. Okay, so we are losing more and more people from liver cancer. Those are their productive age group, and also because it's an internal organ, and when something is happening to it, you don't really see it early. By the time it comes to the attention of the people, and then they come to the hospital, by the time we diagnose, it's at the advanced.
We seem to have lost Dr. Dua, but we'll try and get him on the line back again, restore that connection to him. But Theobald, let's come to you. At what point did you decide to get involved? You indicated that you lost some relatives, and was that the main motivation?
Yeah, that's the main motivation. In 2008, I lost about 4 of my family members to hepatitis. And you know, most of the liver cancer problem is caused by hepatitis. So initially we thought that it was a case because the mode of the symptoms are the same. And when like you go to Antonia Ma, there's a case, you see the symptoms. So we thought that, oh, maybe somebody has cursed him or her. So we were not paying more attention.
What is it that you see that makes you think that it's a case?
Yeah, swallow of the legs and stomach too. And when he's talk, you can see bad breath from his mouth. And yellowish of the eyes too. So we thought that is a case. But later on, when I called my dad, he's a professor in the US, and he told me, no, Theo, it's not a case. It's hepatitis. So I asked myself, what is hepatitis? I don't know anything about hepatitis in 2008. So I just went through the net and searched if I can get any NGO who is campaigning against hepatitis. And I didn't came across any NGO. Most of the NGOs are onto HIV, malaria, TB, by hepatitis 0. So okay, I decided, okay, if there's no NGO who is campaigning against this disease, and this disease came a lot of people, so why don't you form an organization? So I started small, and that I made it to Bad Hepatitis B Foundation. And later on, 2010, the foundation has grown to become an international organization. So other partners decided, no, Theo, when you add your name, look at personal organization. So let's make it Hepatitis Foundation of Ghana, purposely for people who are living with liver cancer and hepatitis in Ghana.
Okay.
So that's the main motivation that I decided to set up this foundation to help people.
And what has this foundation been doing so far since you set it up?
Yeah, when we started this foundation, that time there were no program manager at Ghana Health Service. When you go to Ghana Health Service, you don't have focal person you can talk to. And we don't have any policy because everybody was doing anything. So we decided to pressure that time the Director General of Ghana Health Service to come out with a policy. So in 2012, with support from Roche, they were able to, they came out with a policy to guard hepatitis. In 2014, they came with a guideline how to treat hepatitis. And the foundation too has also helped the patient. We link them to care, like Dr. Mwakundia. If you go to Kolebu right now, it will take you 6 months before you get a doctor. But if you pass through the foundation, because we are working with the doctors and they are also part of the organization, we can able to help you get access to treatment and also quality and affordable treatment. We also have some partnership with the pharma companies we are working with. Instead of selling the drugs to maybe 2,000 or 1,000 Ghana cedis, it is okay. Now we have a lot of people who are living with hepatitis, so why don't you reduce the price so the majority of people can get access to the treatment? So the foundation have also able to talk to other partners in outside the country. Now, if they develop liver cancer is very expensive. Liver transplant is very, very expensive. Now we have doctors in Egypt who will not charge anything. What you have to do is that you take it and donor. If you can get somebody who can donate some of the liver, then you are good to go. Okay. So the foundation is doing a whole lot of things to help the country.
Okay. Let's go back to Dr. Dua, who we have re-established a connection to him. Dr. Dua, so we know about alcoholism, but apparently hepatitis B also has a role to play. Can you explain to us how these things are linked?
So when it comes to causes of liver cancer in this country, hepatitis B is the commonest cause. I mean, it's about 70 to 80% of all those who develop liver cancer in this country is as a result of hepatitis B. And this is followed by excessive intake of alcohol. And what is it is that alcohol is toxic to the liver. So it destroys the liver cells and it can lead to what we call liver cirrhosis. And when you develop liver cirrhosis, it becomes a major risk factor for the development of cancer of the liver. So that is the reason why alcohol also causes cancer of the liver. So if you have hepatitis B and you drink excessively at the same time, it means that you have a double risk, and it makes the chance of you getting liver cancer very high.
So when it comes to alcoholism, we can do something about it, as in avoid excessive intake of alcohol. But what can we do when it comes to hepatitis B?
So for hepatitis B too, something can be done about it.
All right.
Because what we can do is that first we can prevent someone from getting hepatitis B because we have vaccines available that we can give at the time that somebody is born. So childhood immunization is there. And then even in adults, when you screen and you realize that you are negative of hepatitis B, vaccination is there and it's very effective in preventing someone from acquiring hepatitis B. And then also those who test positive, I mean, there is treatment available. And if you put these patients on treatment, it prevents them from developing cirrhosis of the liver and then also liver cancer. So this means that liver cancer is preventable, okay, is one of the preventable cancers that we know.
So you also mentioned earlier that when it comes to liver cancer, but men are more predisposed to that. I'm curious, is it because you mentioned hepatitis B as well as one of the main cause? So how come men are so predisposed? If it was just the alcoholism, then I'll say more men drink, that's how come they are more predisposed. But I'm trying to understand how the hepatitis B and the alcoholism is making men so predisposed.
So when it comes to men more predisposed to cancer of the liver, I think that one mainly is a genetic issue.
All right.
Okay, so I mean, there are certain diseases that tends to affect men more than women. And there are certain diseases too that affect women more than men. So I think it's more like a gender issue playing into it. Why men get it more than women, as at now, is not that understandable.
All right. So, but then what you would advise is that you should screen for hepatitis B and get the vaccine. And if you're also an alcoholic too, you have to watch your intake.
Yes. So the main way of preventing liver cancer is first, as we are doing now, education.
All right.
Let people understand that liver cancer is there, it's killing more people, and the risk factors or the causes of liver cancer are known. And these causes can be prevented or it can be treated. And then, as we said, people should screen to know their status, their hepatitis B status, because the prevalence is quite high. I mean, so if you get to screen and you are negative, then you get the vaccination to protect yourself. But if you are positive, then we have to link you to care, an expert who knows how to deal with hepatitis B treatment. And then the other issue is that, I mean, it's also about affordability, okay? People getting to know their status, but unable to afford the cost of treatment, okay? It's a major issue in this country. And also, if you have hepatitis B, because of the risk of you developing cancer of the liver, we need to monitor those patients. And every 6 months, there are certain investigations that they need to do so that when you are developing the cancer, we can catch the cancer early and offer you curable treatment. But all these things are a bit on the higher side, and then the average Ghanaian are unable to afford. So I think as a country, this is something that we need to look at so that we can save a majority of Ghanaians that are dying as a result of cancer of the liver.
All right. When you say it's quite expensive to treat, what are you talking about here? How much does it cost on the average?
So averagely for basic laboratory investigations, I mean, that you need to do to determine, because not everybody that tests positive to hepatitis B will require treatment. Okay, if we take 100% or 100 people, it's only about 40% of them that is going to require treatment in their lifetime. About 60% will have inactive infection, an inactive infection doesn't cause any damage to the liver as such. So for those, we monitor them to make sure that they are inactive all the time. But for you to determine whether you have active infection, and because of that, you have to put you on treatment. You don't need less than 1,000 Ghana cedis to do the basic laboratory investigations. And when the investigation comes and you require treatment, hepatitis B treatment is a lifelong, okay? You don't take it, let's say, for about 3 months, 1 year, and you stop taking it. And it's not covered by insurance. None of these things are covered by insurance. And you don't need less than between 120 Ghana to 150 Ghana cedis to buy your drug for a month. Okay, so this make it a bit on the higher side for average Ghanaian to afford when they test positive to hepatitis B.
All right, thank you very much, Dr. Chia. Would leave the conversation here with you. I know you have to also go and attend to your patients, but I appreciate the time that you made available for us. But I'll continue with you, Theobald, in the studio. So, yes, does your foundation help at all when it comes to treatment, people wanting to seek diagnosis and the tests that they have to do?
Yeah, initially, as I told you, the foundation comes in to help the patient to get access to quality and affordable treatment. Yeah, we have, that's what I said, we have partnership with some of the pharma companies and some of the private labs, because most of the tests, you have to do it at the private lab. Because when you go to the government lab, they have all the machines, but they will tell you that this machine is for HIV and TB. But the same machine can run hepatitis test, but they are not using it for, because it's HIV programs. And we are always telling the government that, why don't you integrate hepatitis program into the HIV program? Because we already have program that's running. So why don't you integrate it? And because they are using the same medication, they are using the same diagnostic machines. So the foundation is helping a lot of people, but it's not enough.
When you say help, as in, do you cover part of the bill?
Yeah, we cover the part of the drugs. And also the test is very expensive. That's why we are trying to negotiate the price with most of the labs, but it's not easy.
All right.
So we are telling the government to take ownership. Anytime I say government should take ownership, we have a policy. Yeah, we have a policy, but the government should invest in hepatitis education and treatment, because a lot of people are dying for this disease and they cannot afford it. So we are appealing to the government to prevention. Let's start with prevention, mother to child, because most of the chronic patients got it from their mother. So let's prevent mother to child transmission. Mother to child transmission is the vaccine. Let's vaccinate all newborn babies. When you vaccinate from now, in 10 years' time, Ghana will be free from hepatitis and liver cancer.
All right. That's great. Okay. But thank you very much, Theobald, for coming through. Would you also want to reach out for any assistance, people who want to support your organization and what you're doing?
Yes, we need support, but majority of our support comes from outside the country. Ghana, when we write applications, they will tell you go and come, but most of our funding from outside the country. So we are appealing to the companies here in Ghana. They should support us, because we have to go to, when we went to Upper West, somebody there have not heard about hepatitis before, and the rate there is high. The prevalence rate at the Northern region is high. So they should come on board. Let's bring 50-50. Let's 50-50. And we're also appealing to National Health Insurance. They should support hepatitis. Not even 100%. They should do the 50-50. If you go to Europe and America, it's 50-50. Pay 50 and let me so pay 50. But Ghana here, it's not like that. Yeah. And HIV drugs, they are banning it $1. So if government take ownership for hepatitis treatment, they are ready to make the drug some cent.
Yeah.
So we are appealing to the government to take ownership. They should invest. You shouldn't do a fire service approach.
Okay.
When there's a fire, we just take our tools, then we go. No.
You're looking for a comprehensive
approach to tackle the hepatitis and liver cancer.
Okay. Thank you very much, Theobald, and we urge you all the best. We wish you all the best with the work of your foundation. So Theobald is with the Hepatitis Foundation, Hepatitis B Foundation.
Hepatitis Foundation of Ghana.
Of Ghana. All right, thank you.